our special guest of honor, Dr. Foku Awono Williams, a man I have read a lot about and I have deep respect and admiration for. A rep of the municipal chief executive, chairman of GRNMA, OT and Volta, Mr. Moses Iba, Nkwanta South District GRNMA chairman, Mr. Tenkorang-Twum, GRNMA Youth Coordinator for Southern Belts, Ms. Happy Nkwanta, our ever hard-working district executives of GRNMA, our revered Reverend Father, distinguished nurse managers here in present, administrators here in present, our gallant, retired but not tired nurses and midwives, colleagues of the noble profession, ladies and gentlemen, the Ink fraternity. It's a privilege and honor to be here this morning. And for the first time, traveling down to Nkwanta. Growing up, I was told that I have cousins in Nkwanta and Lulubi. For Lulubi, I've been there a couple of times. As in Nkwanta, I never got an opportunity to come here to Mankara time. So to me, it is a family unification. And I have a lot of stories to carry home when I go back. I dare to say there is no better time to choose a theme like this, as we witness the ravaging COVID-19 pandemic, and has no respect for developed or developing country, small or mighty, rich or poor. Indeed, the world is sick, and it will certainly take nurses and midwives whose nimble figures are quicker on the buzzer than everyone else, to use innovation and critical thinking to salvage the situation. These bold and courageous people, in the midst of this global coronavirus pandemic, which Ghana has and is experiencing its third wave, are the front liners of the response, providing high quality, respectable care to our members and the citizenry of Ghana, leading a legitimate discourse of educating people and correcting ignorance and disbelief among our citizens, and sometimes moving from community to community, collecting data for clinical studies, while others are masking up and hiding in their rooms. I take this opportunity to congratulate all nurses and midwives who have taken charge and are putting their lives in an arm's way in bringing smiles in the faces of patients and their relatives. I therefore want to take this opportunity to implore the chairman, who is also doubles as the municipal health director, to do whatever he can to make sure that the 50% that was promised and the insurance that was promised by the government for nurses and midwives who found themselves working as frontliners at the division of the government, which we disagree, and those who got infected should be paying their insurance so that to serve as a motivation for others. Mr. Chairman, the tendency to subtly sideline nurses and midwives in policy formulation, despite the unique position they occupy in the health continuum, remains an impenetrable obscurity. We need to reverse the narrative and to recognize that the nurse or midwife yesterday is not the same today. There are nurses and midwives with masters, double masters, PhDs, double PhDs, and many have ventured into other interesting areas like law, journalism, human resource administration, research, just to mention but a few. Historically, nursing and midwifery education in Ghana has moved away from certificate programs, qualified registered nurses, used to be called QRNs, enrolled nursing, state registered nurses, SRN, which I'm one of them, diploma program, post-basic degree program, master's programs, specialist programs, as we have at Ghana College of Nursing and Midwifery now, and to PhD in nursing. The auxiliary cadre, such as QRN and SEN program, were initially curtailed due to the increase in training of nursing and midwifery professionals. However, in 2006, there was the reintroduction of auxiliary training, health assistant clinical HAP, and health assistant preventive, which was variously opposed by the then president, Mrs. Asari Aloti, and daughter of Islam. But we were told as a union that they are not going to be called enrolled nurses. They are health assistant clinicals and health assistant preventive. But at the end of the day, they were employed as enrolled nurses. We were not opposed because we didn't want nurses to be trained at that level, or we didn't want nurses to join us. But we saw the frustration that was visited on those that had already read that program. And we saw that never again must this be visited on nursing and midwifery. But the program was politicized, although it was supposed to be a stopgap measure, for 5 years. A decade onwards, we are still training auxiliary nurses and midwives. And data from government payroll of March 2021 revealed that certificate holders in the profession numbered up to 47,539, while diploma holders were up to 45,063, and degree holders only 15,101. Recently, Mr. Chairman, when Barbados and other countries knocked our doors for nurses and midwives, we were looking for degree and specialist nurses and midwives. Barbados. As far as I'm concerned, Ghana is far better than Barbados. Yet, they wanted degree holders and specialist nurses and midwives to take care of their people. Why can't we do same if we are the trainers of same? Currently, the professional nurse-patient ratio in Ghana is below optimal, and the delay in employing newly qualified professional nurses and midwives have further widened the gap between the availability of professional nurses and midwives and the numbers required to provide quality care to Ghanaian populace. In many countries across the globe, such as United States of America, Australia, Canada, and Nigeria, our next door neighbor, entry to professional nursing and midwifery is a degree, BSc in nursing. Others such as South Africa, Sierra Leone, Liberia, Belgium, Brazil, and many others have diploma as entry into nursing and midwifery. However, it is observed that some of these countries have auxiliary staff who provide basic support services and are not regulated by the Nursing and Midwifery Board or councils of those countries. They are usually trained on the job and undertake short courses instead of the 2-year training which is being done in Ghana. Padula and Debison in 2019 conducted a research which was published in the Lancet and argued variously in their findings that a highly qualified nurse, or highly educated nurse, stand a chance of reducing mortality sharply. And therefore, we want to take this opportunity to ask government to halt the training of the auxiliary program and also find innovative way of helping those such programs to be upgraded. We need to remove this quota system, which is not helping us in midwives. I remember, as a young nurse practicing in 2001, you could obtain as many study leaves as possible. Now it's only 2. So if I'm a certificate nurse and I'm entitled to only 2 study leaves, I pick one to read diploma, I pick another to do BSc, it means I'm stuck. Meaning that I cannot progress. We think this is highly disincentive, and government must take a bold step to address that for us. Government and other stakeholders must find an innovative way to upgrade all existing nursing training colleges to degree awarding. We have the infrastructure, we have the human resource base. What is important for us to do is to have the political will to upgrade those existing universities. Already, most of these schools have well-established affiliation with some of the existing universities already, and therefore, it's just a matter of widening the scope of the affiliation so that we can have them award degrees. As your General Secretary, I want to let you know that certain allowances are tied towards your qualification. And therefore, if we don't advocate, we don't come together to advocate, to push the frontiers of nursing and midwifery in this country, we shall remain impoverished. And I believe that we will do what is necessary as your leaders to make sure that that feat is achieved. I also call on government to expedite action on employment of newly qualified nurses and midwives to meet the human resource needs of hospitals. Again, there is the need for the private sector to also be adequately resourced so they can employ qualified nurses and midwives and pay them appropriate and equitable living wages. The Ghana Registered Nurses and Midwives Association and the Nurse and Midwifery Council, which is a regulator, in the coming days shall work out modalities of pricing of nursing and midwifery services to prevent the abuse of the economic right of nurses and midwives by profit-oriented hospital managers and administrators in the private sector. Principals should therefore ensure that they train the required number and cadre that will meet the human resource needs of the health system. In this regard, it is noted that specialist nurses and midwives are few, and it is recommended that the Ministry of Health and the government support the Ghana College of Nurses and Midwives to train more nurses and midwife specialists to provide adequate health services across the country. Mr. Chairman, one fundamental underpinnings of transforming the health sector is to bridge the gap between theory and practice. Globally, theory-practice gap continues to be reported, and Ghana is no exception. Nurses and midwives in education and those in clinical practice are mostly in their silos with minimal engagement among them. However, students are taught by faculty who may not be very conversant with the real-life clinical issues, and clinical staff who may also not be aware of the current evidence. Indeed, a strong collaboration between faculty and clinicians, dual appointment, team teaching, preceptor training, and the use of shared facilities would go a long way to bridge the gap. Clinical nurses and midwives with the requisite qualification and skills may be appointed as adjunct faculty or lecturers, and faculty may also have a part-time employment at the various hospitals to assist in the teaching of skills in the clinical area. Nurse managers should facilitate clinical placement opportunities for academics and ensure their research efforts are beneficial to practice. I also recommend an enhanced preceptor institutionalization in hospitals for students training, since preceptors are the masters of the learning environment and drive this experience. The precepted clinical setting is one of the most influential learning environments. Socialized and perceive their professional roles. Preceptor understanding of the competency-based learning approaches and their input for implementation are crucial for program success and development of the future of our profession. As I bring my keynote and end, I'd like to encourage nurses and midwives here in present to be united. The only way that we can fight the injustice and the vulnerability that we find ourselves today is to come together as nurses and midwives and reposition this profession where it belongs. Thank you for your attention. God bless you for your time.